Welcome to Behind the Mask in Conversation with. Behind the Mask is a neurodivergent focused podcast that aims to offer support, knowledge, understanding, and most importantly, exposure to the neurodivergent community. If you are here, firstly, I hope you enjoy the episode. And lastly, if you are enjoying it, please like, follow, share, and subscribe because your support with this podcast can really help us push the message out. Keep being amazing all. And thank you. So this is episode 4 of season 2 of Behind the Mask. So today I'm joined by Dr Ali Ajaz, who is a regular here on TikTok, where we're launching this, and there's a lot of content in and around neurodivergency, brain health, and basically pushing content out to support individuals to try and understand and live better. So welcome. So tell us about you then, Doctor. Over to you. Tell us about yourself and what led you down this path of becoming a neurodivergent creator.
Yeah. Hi, Paul. Thanks again for inviting me to your podcast and a chance to speak to your audience. So I'm Dr. Ali Ajaz. I'm a consultant psychiatrist and I work in my own practice in Canary Wharf in East London. And I've had about 20 or so years of experience as a medical doctor, most of that within psychiatry. And I was in the NHS as a forensic psychiatrist until a few years ago. And then I moved out and now do my own thing. And one of the main reasons why I did that was that it allowed me to focus on areas of psychiatry that I had a particular interest in, but also allow myself to work with people in ways that I can't in the NHS. So looking at a more holistic approach and really understanding what's driving mental health problems, because one thing we know for sure is everything's getting worse. So not only do we have more neurodivergency within the general population, we have more depression, anxiety, dementia, everything is going south rather than north. So I felt as though I needed to do something different in order to try and make more of a difference than I was. And a very good friend of mine, Reese Mander, who's also on TikTok, Reese Mander Nutritionalist, he got me into TikTok saying, look, there's lots of things that you can contribute. And so he's pushing me and eventually I came on and it's kind of built slowly from there. And what I can see is that there's a big need. People are hungry to find out more about neurodivergent problems, but ADHD in particular. And I guess in the last few years, worked a lot within the ADHD community and assessing and treating and having treatment programs to help people improve their lives. So it's been quite a journey so far, and I think it's just the beginning.
It is, and I think I would be taken down by my community if I didn't say there's absolutely been an increase. The statistics are there, and the need for assessments is more prevalent. But I think, do you think that it's the fact mental health's been around and poor for years, and actually my take on it is that actually undiagnosed neurodivergency could have been a driver of a lot of poor mental health through lack of understanding of an individual's brain, their build-up. And actually, although it is increasing with diagnosis, the actual there's a decrease in diagnosis of other conditions which were previously diagnosed before ADHD was looked at. Have you seen similar yourself in things you've looked at?
Yeah, so I know it's a very passionate point around the prevalence. Is it that people are getting sicker, or in terms of psychiatry overall, is it that there's more neurodivergent people, or is it that just because it's been unrecognized and undiagnosed that now we've got greater awareness and platforms like TikTok is just amazing for that? Is it that finally people are being recognized? So it's always kind of been there. And I guess I'm on the fence, really. I think it's a bit of both. But it's really difficult to tease out, I think, in any research to say, well, what's undiagnosed and what's actually increased prevalence. I think we're seeing in psychiatry in general, as I mentioned at the start, we are getting more depression. So about 20% more depression than we had 20 years ago. We are getting more anxiety. 1 in 5 people will have an anxiety disorder in the next year. 1 in 6 people will get dementia by the age of 80. Everything's going south. So there is a general trend of more problems rather than less. And I mention anxiety and depression in particular because they're often the diagnosis that people get misdiagnosed with when it comes to ADHD, because they are actually core features. I would say they're the core symptoms of ADHD. I've not met anyone with ADHD that doesn't have anxiety, serious anxiety, doesn't have problems with managing the mood and periods of very low mood. So often there's this what we call diagnostic shadowing. You can get fixed on the surface level without really looking at what's underlying it. So it is complex, but I think it's a bit of both. I think generally it's on the rise, and I'll have my ideas around why that's the case. I'm more than happy to share them with you. But also there's this big kind of reveal that actually there's all these people that supposedly had depression and anxiety that they couldn't shake off, really were misdiagnosed and have ADHD as an underlying factor. So I see both in my view.
Yeah, and I think for me that's what you've just said mirrors my experience. So as somebody that has never not been an anxious person, I'm quite a social person, but I'm extremely anxious. My route with mental health was breakdown at 19, breakdown at 21. Doctors diagnosing depression, high functioning anxiety, OCD as a root pathway of it, and things like that. And my treatment path was to go on SSRI medication. Now, what I know now is actually in some cases SSRIs aren't always the best for neurodivergent brains. And I was 34 before ADHD was anything that was even explored. But what I find strange for me is I'm now 36 and I no longer take any of the medication I've been on for almost 7 or 8 years. And I think what the importance of putting the spotlight and understanding for me on was actually understanding that burnouts are not depression. Now, the doctor didn't know that, they were just treating surface level kind of what I was presenting with. And that's where context is so important. But I firmly believe that there's so much more that GPs like yourself can't do because of your position that actually the country isn't set up to treat. So many people fall into this depression, anxiety, medicated pathway because the inability to explore further.
Yeah, so just a minor correction on that. Psychiatrist, not a GP, but I know lots of GPs. I think you might be surprised to hear this, but most psychiatrists aren't very experienced when it comes to diagnosing and recognizing ADHD. It's not in the training, and partly it's not in the training because we've not had ADHD specific services in the NHS. There's been a greater need now, and I think things are ramped up, but it's clearly not to the level that we need because we've got years and years of waiting lists. But when I was training, there's no ADHD service. You don't see ADHD as an adult psychiatrist. As a child psychiatrist, because in psychiatry you either train as an adult or child specialist. As child specialist you do, but most psychiatrists are adult psychiatrists and they don't really see ADHD. So when someone is coming in with mood fluctuations, coming in really real intense emotions, you're more likely to get diagnosed either with depression, bipolar, borderline personality disorder, because these things are what more psychiatrists are more accustomed to. That's a real big problem. I think it's changing now. It's have to change with all the emphasis and pressures on ADHD and psychiatrists really trying to get their act together. So I think that's been a real big issue, and it might be surprising to your listeners that most psychiatrists have zero experience in diagnosing and recognizing ADHD.
Yeah, and well, I think some may be surprised. I'm not personally, just because in relation to things I've looked, it's not there. It's not part of the training, and it's why there's such gaps and loopholes and so little kind of practitioners against the requirement that can work on the diagnosis and support the process and things like that. And I think that's why we've hit this kind of crash at the minute where there's too many people and not enough service available, and it's become a block. And it's kind of the beauty of social media is actually the ability to connect with people who feel like you, because for many years you just sit in your own head and assume that you were just broken. I know I did. I know I generally just thought I was broken. I thought I couldn't fix myself. And it wasn't until I found a community of people that I related to and you could talk openly with, it kind of started to make sense. And I think so many more people are just after that clarity after years of kind of existing on medication. It's difficult for a lot. And I think I echo a lot of the community in saying that. So what is ADHD then? So for anyone who's coming in, like what's the general kind of consensus around what ADHD is?
So the easiest way that I can describe it is that it's a pathway where your brain develops not in the way that it was intended to. So it develops in a way as a child. There's a number of structures that are smaller than compared to children that aren't neurodivergent, that don't have ADHD. There's issues with how the brain communicates with each other in terms of some of the chemicals and the neurohormones that we have in there, and also blood flow and metabolism. So if we're looking at many aspects of how the brain functions, if you have ADHD, your brain takes a slightly different course where it's setting you up to struggle ultimately functioning as a human being. And so there are specific changes that we see. So it is a structural, chemical, but also kind of communicative issue when it comes to what ADHD, and this is all reflecting in how the brain develops. So it's a neurodevelopmental disorder. So basically, you need it as a child. You need to have some sense of struggling. It's not something you develop as an adult. It needs to be there from the beginning in some way. You can't have a completely normal childhood and be fine with everything, and then all of a sudden, bang, you've got ADHD. It doesn't work like that. So it's very important to have it struggling, and there being evidence of struggling early on in life. And really, it was thought that children would grow out of it. And certainly that was my conception early on, that, there's this thing called ADHD, but most kids would probably grow out of it. A bit like kind of asthma. A lot of children have asthma when they're small, and as their lungs grow and develop, it becomes less of an issue. It comes back again when you're older. But as an adult, lots of children grow out of asthma. And I had the idea that ADHD was similar.
I think that's so.
I was given, but clearly not.
I've worked in education for 20 years, and with a specialist focus on SEN young people, supporting their needs, ADHD being one of them, and which is why it was a shock to me when I understood what ADHD actually was, not what we was taught it was, because I was of the opinion it just purely reflected in behaviours. It was more prominent in boys, and although figures will still show that, I think gradually it's going to level out, because actually it just presents differently, and it's a human thing rather than a gender thing. And like what was interesting to me is to find out that I always had it, and it was just how extremely the symptoms and the impact of the ADHD were having me at different parts in my life. And for me, I had a secure home. So although there was visible behaviours when I was younger and experiences, it was a lot more stabilised for me. Mine really became prevalent and impacted me significantly when life stabilisers came off and I had to face the world on my own without anybody stopping me. That's really where mine was significantly apparent for me. But to learn that I've always had it, and actually it is just my brain, there's something reassuring that actually it's not that I'm broken, I'm just geared differently kind of thing.
Yeah, I guess we're all in our heads, and a lot of people with ADHD tell me this, that I thought everyone was like this. Everyone has this constant chatter, this relentlessness, this distraction, this struggle just to get stuff done, because we all live in our own heads. What reason is there to have that it's not normal? And so then people kind of accept things, and then that this is, I'm a bit like this, and you get kind of nicknames as the scatty one, or the one who's always forgetful, and you kind of think, well, this is who I am, this is my personality. And then you get doctors telling you, well, you may be anxious or depressed, and then it just becomes more and more difficult to actually get out of that. And to say, well, actually, I think it's something more than this. And many people with ADHD who've been diagnosed with depression and anxiety say, well, I just know it doesn't fit. I just know it doesn't fit. It's something that niggles at them, and then it takes something like TikTok, something on social media, something that resonates with them. Or it could be someone that they meet, that they talk to, or something that a colleague says, or maybe have you thought about ADHD? Just something there that is, I find, a catalyst, and it kind of frees people up, from these shackles of being told that you just need to really shut up and just get on with stuff because there's nothing wrong with you. You look okay.
and that's the thing. It is that hidden disability, and like for me personally, and a lot of people, I know a lot of people who are establishing in their 30s and 40s that they not only have ADHD, but they're also autistic, so they're ADHD. And actually, like when you look at how ADHD can impact an individual with the external chaos and the internal need for routine, structure, stability, and that, like for me, it makes so much. When I'm going to the doctor going, I feel crazy, I've got this constant monologue in my head. One minute I feel out there, I'm going wild, the next I just want to hide away. And you can see why borderline personality and things like that are considered, because it is, and bipolar, because it's so conflicting in how both things present. But what happens to why is it that a neurodivergent brain cannot utilize dopamine in the same way a neurotypical brain? Because what happens in our brain that means we don't get that same level?
So the real reason why there's neurochemical imbalance, we're not sure. So what we do know is that there's lower levels of dopamine, lower levels of noradrenaline and adrenaline. These are crucial neurotransmitters and hormones that act on the brain and the rest of the body. So we know that they're much lower in a lot of research has been done in kids. So a lot lower in children with ADHD. And also a lot of the medications, the stimulant medications and the non-stimulant, are designed to either increase dopamine, the stimulants, or the non-stimulants like atomoxetine, like increasing noradrenaline. And what we see is that increasing is suggesting to us that levels are lower as well. So there's two data points that say that the levels of dopamine and certain neurochemicals are lower, but we don't know the exact reason. And there's been a lot of research and a lot of interest around genetics, and say, well, there's maybe a genetic defect of transporting dopamine across into the nerves, and there's a problem with that. That means there's less because there's too many of them, and that's a theory, and that's certainly been supported by some people. But the data shows that we're just not sure. We can't pin it down to the genetics fully, that it's a contributing factor, but not enough for us to do a genetic test and say, look, I can tell you if you've got ADHD. So we don't know the why, but we definitely know the what, that a big part of it is the neurochemicals and dopamine, noradrenaline, adrenaline in particular. And that has massive implications on what someone is able to do and how well the brain is able to function.
Because I mean, in normal fashion, I've had a hyper focus for 2 years now, reading because it's a sort of interest. And when you look at the genetic side of things, there was a lot of suggestion around there's like a 70% chance that actually if your parent is neurodivergent, then you are 70% more likely to have it as a child to neurodivergent parents and stuff. And with the genetic side of things, do you think it'll get to a point where we look at the genetic of something and we're able to identify? Because I think as it's getting more seen and more prevalent and more looked into, surely the understanding of it is only going to get greater. And do you think that that'll become a significant part of training as well for like new practitioners?
Yeah, I think it's a great question, because this is actually a much more controversial area than it sounds. So the genetics of things.
Yeah.
And also the what I would call the hereditability. So the passing down. So if you've got a parent, child's much more likely to have it. You talk about 70%, and I kind of agree with that. I think I see that a lot, especially in adults coming for assessments. They realise through their children's assessments that they might have ADHD, and I've had some parent-child combinations that I've assessed over the time. So it's certainly a real thing, and I see that a lot. So I think that 70% is probably accurate, but hereditability is not the same as something that's passed down genetically. We have a tendency of conflating those two things together. And the example that I'll give is inflammation. So there was a study that was done in Japan a couple of years ago. I've done a couple of posts on this, looking at inflammation in the mother's body as she's pregnant with their child. And what they concluded was that if the mother was inflamed, so if she had high inflammatory markers while she was pregnant, that was considered as a direct cause of ADHD in children when they were assessed at the age of 8. So the mother had inflammation, that increases the chance of her being neurodivergent, and then she passes inflammation on through one mechanism to her child, and then they're more likely to have ADHD. So although genes are important, they do increase risk. There's also the interaction between environment and the environment of the parent, and the mother in particular, because she's the one that nurtures the child and has the fetus growing in her. So it is complex. So hereditability is both genetic and environmental. So I read a paper. It was like a review paper looking at all the genetic data. So really trying to get down to, is there a genetic cause for ADHD? So it's what we call a systematic review, that it gets lots of other papers and studies and puts them together, tries to come with a conclusion. So this was from a few years ago. And the conclusion was that there's not enough data there to show convincingly that there's specific genetic mutations that are responsible as a cause. In the paper, there were probably about 30 different genetic mutations and genes that were identified, probably 30 to 40. It was quite a big list. And they said there's not enough to pin it down to a group or a constellation or individual genes. And what they also concluded was that actually environment is probably a very important factor to consider, because we're not actually getting where we need to with the genes. So I think the environment is more important and will become more important, because we know that the environment inside the body can turn genes on and off as well.
So you mean environment in relation to those first 9-10 months when you're developing within the mother kind of thing?
So that environment and also the environment within the person, so i.e. your health. And that understanding has really unlocked my approach to helping people with overcome symptoms of ADHD by really looking at their overall health. If we can improve the health of your brain, you can improve your experience of life, whether you have ADHD, whether you have depression, anxiety, and that really comes into that understanding that environment is also a big factor when we look at why someone is suffering from ADHD.
And I think with that as well, and it's probably it might just be a wording or disagree. I think the main thing with ADHD is the management of the symptoms, rather than I don't believe it to be anything you're ever going to get rid of. I think it's such a complex thing. There are multiple factors that will help you manage and function better, whether that be the medical route or holistic route, whether it be giving your body the things it lacks to help you function in a better way and things like that. So what ways do you feel then? So when you're working with your patients and your clients and whatnot, what ways do you suggest to them to help improve the way in which their ADHD symptoms are managed or present? Are there some top tips you'd give to people that are listening in?
Yeah, so I would say that I see as a shorter term and a medium to longer term approach. So in the shorter term, if someone has a diagnosis of ADHD, the main thing that accesses, that nothing else does from a treatment perspective, is medication. So what I find, stimulant medication can have the most drastic improvement in someone's life experience within days sometimes, but certainly within a few weeks, if it's something that works. And I'd say about 20 to 30% of people just don't get on with the medication, but majority do. Majority have tangible improvement, and that happens quickly without making any changes to anything in your life. Your experience can be tangibly different, so people can really just get stuff done. They can focus, they can concentrate, they can relax. They can engage with people without getting distracted and pretending to know what they're hearing and nodding along, and there's a lot of anxiety and stress that everyday things
And
just
I
become
think a lot of it comes through masking as well, as you say, like trying to present in a typical way and but actually trying to control or kick in that executive function or get your brain to kind of cue and drive yourself to do things, or listening to conversations is a lot more intense. And I think we're so aware of it. And certainly for me, I find myself literally giving people death stare, just trying to make sure I'm remain focused. I'm not medicated at the moment. I'm awaiting to start titration, but those are some of the things that I'm really hoping to get benefit from. Just that task initiation and concentration and listening and understand as well.
Yeah. So it kind of puts people, the medication can put people on that trajectory of being like everyone else, in the sense of being able to do everyday things. It doesn't change you as your personality. It doesn't change your character. So that's something that people worry about, that this is just, I'm not going to be the same me. But I don't see that. I see that it just allows you to be you rather than to change you. And I think there's a difference in that. So Medicaid can be very powerful, but there are side effects to it. And often with the stimulants, it's kind of a bit of a headache, dry mouth, a bit of anxiety. You can get suppressed appetite, so you just don't get hungry. It can affect your sleep and blood pressure and pulse. So these things we kind of keep an eye on. But for most people, they're transient. They kind of come for a few days, maybe a couple of weeks, but over time they improve. The issue with the medication is that we don't really have any long-term studies to look at their safety. So a lot of the studies are around about a year, and what they show is very safe for a use of around a year. But in terms of 10 years, 20 years, 30 years, the data is not there. And some of the things that I've seen are studies on rats rather than people, which are kind of questions. Why don't we have the data for people? But the studies on rats show a few concerning things, like having smaller brain sizes over time with the use of amphetamines. And it's not really to alarm people. It's just to say that we don't know the long-term benefits. So that's why I break it down into shorter term. I think the medication can work really well shorter term, but in the longer term,
as a bit of a stabilizer.
Yeah. So people can get stuff done, and not only can they get stuff done in life, they can then also start getting stuff done to invest in their brain health, and that is crucial. So people who can get into good habits that are helping the health of the brain improve, and we can talk about what they are in a moment. What I find is that over time, there's less of a dependency and need on medication in order to function. And so that's not to say that people can just come off medication completely, but some days they might need less, or they don't feel they need as much, or they can take the weekend off and still be quite okay. So it's a process. I think, I haven't worked with people for 10, 15, 20 years with ADHD to say, well, this is what happens if you keep up. But certainly over the course of several months, and I'd say around 6 months, if someone is able to invest in their brain health between 4 to 6 months, whilst on the medication, there becomes less of a need and reliance on medication. And that's quite a powerful thing, that people don't feel as though they're dependent upon drugs just to function, because a lot of people just find that really difficult to accept. And me as a doctor, as someone who's supposed to help people, prescribing drugs and saying get on with it is just not enough. It's not enough. We have to do more. And what I found over the last few years, probably the most helpful non-medication strategy is nutrients. And it's a form of nutrient therapy that really helps improve the health of your brain, that your brain starts working at a higher level. If you give it high dose nutrients, and I work with micronutrients, cod liver oil, which is high in omega-3s, and a probiotic, they're the staple foundation of my nutrient therapy. And there's a lot more around that, but this is why I put everyone on. And what I see is that people, whether they're on medication or decide not to go on medication, they all improve in terms of symptoms with the nutrient therapy. And the beauty of the nutrient therapy is that it's very safe. There's no side effects, and it's something you can take longer term.
Is it like a high-level EPA or something with the cod liver oil? Because I take it myself, and if I'm honest, I've got it on order now. But when I first looked into it, it said something. Is it the EPA is good for an adult. The other one's good when you're younger. Is that correct?
So there's a number of omega-3 fatty acids. What we've shown in the research is that EPA and DHA are two types of omega-3s that they seem to be more important when it comes to ADHD. The fatty acids are important because the hard mass of the brain, about 70% of it is made up of fatty acids. So if we want the brain to function optimally, it needs a good supply of fatty acids. And we just don't eat healthy fats at all in our diet. We've got this idea that we've been conditioned that something that's fatty is like bad for you. That's going to give you heart disease and you're going to get a heart attack. So there is this idea of healthy fats. We're not raised with in our culture here. So
there's a lot of talk around gut health as well, isn't there? When like the gut health linked to the brain and ADHD and stuff and all the connection.
Yeah, and I would say that that's probably one of the most exciting areas of medicine that is kind of emerging over the last few years. Our understanding of the gut-brain axis, that actually, to have a healthy brain, you need a healthy gut. And therefore, if you're struggling with your mental health, it's likely that you're struggling with your gut. And really, the gut is the gateway to health or the gateway to struggling in life. And what do we mean when we talk about the gut? So there's two main broad areas. One is the lining of the gut, how well the integrity of the gut lining. It's one cell thick, and if through stress or through alcohol or through eating junk or through antibiotics, these things can become compromised, the lining of the gut, and then you can start absorbing molecules that you're not designed to, and that can trigger inflammation and your immune response. And we know that in ADHD and autism, there's a higher level immune dysregulation that's there in the background. So there's one thing about the gut lining and the gut integrity. Another thing is the gut bacteria, so the microbiome. And so we have in our gut probably about a couple of kilograms weight of microbiome of bugs, so bacteria, yeast, fungi. And if that is altered and it's like an ecosystem, if it's out of harmony, it can cause havoc with our health. And in particular with ADHD, if the gut bacteria, if certain types get out of control, it can affect how well we make neurotransmitters. It can affect how well we manage immune responses and neuroinflammation. And these things have a direct link with the brain. And so looking at trying to take a holistic, what does it mean to take a holistic perspective to health? It is really to understand how the brain is linked to everything else, and the gut in particular. So it's a really important area. And it's really a foundation of how I try and work with my patients. It's really empowering people to say, look, if you sort out your health and invest in it, you can do whatever you want. You're not dependent upon anything. You can get to a level. Now, whether you still have ADHD or whether you still have some symptoms or what have you, the most important thing is, can you reach to a point where you're achieving what you want to?
It's more manageable and under control.
Yeah.
And that's where, like, that's a side that does interest me, because it makes sense to my brain that if you're putting things in your body that help to strengthen or produce the things that you're lacking, therefore that just as a simple cycle is going to benefit. There's no argument that there'll be no benefit there. And as you say, I think time is going to be the thing that enables us to look at holistic against medical, or the combination of two and things like that. And I think that's hopefully years down the line, studies will be able to kind of give more around that. But
you're absolutely right. It's intuitive that what you put into your body, and I see food as information. It's information, and so you either decide to put in good information or bad information. But either way, it's having an impact, and you have a choice as to what data goes into your body and brain. And food is important because it provides us what? It provides us nutrients.
Mm-hmm.
And so it's no surprise when you give people nutrients who are likely to be deficient, high dose micronutrients, then the brain starts waking up and working better. And so food is fundamental in that. And it's been known since Greek times that food is so important. Let food be thy medicine is a famous quote from ancient Greece. But somewhere along the line in our current medical model, we've taken we've taken how all the centuries of what we understand good health to be, and it's been superseded by this need to treat symptoms with drugs. And there is certainly a role in that, as we've discussed, but it's so powering that doctors are intoxicated by it, and that's the only tool they have in their toolkit. And when you ask your psychiatrist why doctor am I getting this, they can't really tell you, because they're only working at one superficial level, and that's the way.
You're saying this is your problem. I know this will help you with it, and this is something that I can do, rather than having the time to explore.
Yeah.
It makes a lot of sense. Now, I'm aware you need to go at past, and what I did say is that I'd open some questions up to the guests who are watching live to give the opportunity. So if anyone does want to drop a question across, and I can get them asked in the last 15 minutes. So while we're waiting for some questions to come in, what are the main things then that you'd put? So if you were to advise somebody to get supplements, for example, or things to put into their dailies, what would the 4 key things that you'd say, get these as a starting point for it?
So the 4 key pillars, so we've talked about nutrients. So you need to nourish the brain in order to help it work better. And if you're investing in your brain, you get outcomes. And it's not it's not difficult to believe. So the nutrients is a high dose micronutrient, a probiotic, and cod liver oil, 3 to 4 grams. The micronutrient I use is in my bio, in the bio of my profile. It's called Brain Wealth, and these are specific nutrients that I use because they were the ones in the data and the research that I saw a few years ago, and I've been using them ever since. So not only are they evidence-based, they're based on my own clinical practice as well. And the key is taking 4 3 times a day. So it's 12 a day of this particular micronutrient, but that is really key. You need that level. That's the treatment protocol for ADHD. Nutrients aside, food. So the simple thing is to try and take out the sugar and the junk food. And that can be really difficult because impulsivity is a key aspect of ADHD. Those kind of carb high sugar foods, help give a bit of a dopamine hit. So it's a real challenge. And I know it's not easy to do, but in order to give your brain a chance, give your gut a chance, trying to reduce and cut out high carbs and sugar, any sugar, artificial sugar, sugary drinks, replace them with something else. And at the same time, increase your protein. What we've seen in the data is that high protein diets improve symptoms of ADHD by themselves, but they also increase the effectiveness of medication. So high protein, lower carbs, low sugar, high protein in your meals. We don't need to snack. You need to cut out all the snacks. If you have 2 or 3 meals a day, there's no reason to snack. And most of us live pretty sedentary lives anyway. So I think it's difficult to maybe justify 3 meals a day. But no snacks and optimizing your meals. So that's a food. I would say exercise is key. Okay, so everyone's at different levels. So it's not about going to the gym and just killing yourself. If it's just walking, if that's your level, you've got to start somewhere. So I would say 30 minutes every day of exercise and build that into your daily habit and lifestyle. But build it up to a level where maybe you're doing cardiovascular or resistance training, 1 hour, 3 or 4 times a week. And that's really powerful as part of a whole package to try and help improve your brain health and reduce ADHD symptoms.
Fab. So a question that was asked, and I think you did some content on this recently, actually. So in relation to women, their menstrual cycles and the impact that can have on their neurodivergency, but also the medication that they may be taking to treat. Is there anything around that women can use to help themselves leading up to, during, and after their menstrual cycles if they're neurodivergent?
Yeah, so it's a lot more complex for women. So no one's going to thank me for saying that, but it's because of the hormones and the cyclical changes of estrogen in particular. Estrogen promotes dopamine. So when you have high estrogen, things are a bit better. When you have low estrogen, its ADHD symptoms are worse. So in the second 2 weeks of the cycle are much more difficult for women. So the micronutrients have been shown by themselves to improve hormone balance as well as symptoms of ADHD. So I would definitely recommend the Brain Wealth micronutrients. There are other more herbal options out there. One's called Vitrex, and that is a natural herb to help try and balance the hormone fluctuations within a regular cycle. But if you're eating well, if you're exercising, if you're looking after yourself, also these things are very important for your hormone balance. And it's about your lifestyle as well as specific things you can do. So I expect all these things to improve over time, but it is more challenging for women, and especially when they get towards middle age and perimenopause and menopause.
And I think studies on women are even further behind than men because of the belief back in the day that women didn't have ADHD and it was very much a young boy's naughty thing. I think those stigmas, we're only really now seeing a small part of the impact it has on women, and actually, hopefully in time, more and more work and research is put into understanding what you've just added there is really beneficial, and I think a lot of women will appreciate that.
It's biased. The diagnostic criteria is biased against women, and there was a study that was published about 2 weeks ago looking at data across Wales over the last 20-30 years. I can't remember the exact duration, and what that concluded was that the diagnostic criteria has been biased against women completely. And because women internalize their symptoms more, and they're quieter, and they go under the radar more, and there's a lot more internal distress. So not only is it very different to men in some cases, diagnosing ADHD as an adult is also very different to children. And this is something, as an adult psychiatrist, I have to kind of figure out, and I've kind of learned on the job, because you still have the same criteria for ADHD as a child and as an adult. What adults do that children don't do is find a way to cope with life and get on with life. And so some doctors are very rigid with the criteria, and they penalize people for excelling in life with ADHD and really trying everything they can to do well. And those that do well, they get penalized because there's no way you can have ADHD because you're succeeding in this area of your life.
And it's kind of, I've managed to get here, but it's been tough. But actually, where could I have been? And it's kind of that, it's that stunted potential of actually, we're saying you're doing well, but actually, how well could I have done with adequate support and understanding?
Exactly, and that's something that's so crucial in my assessments. I spend a long time not going through the criteria, but trying to learn about someone's life and try and learn about their journey and just how difficult things have been, and trying to get a sense of their potential and where they are and what trajectory. And really, that's the bulk of my assessment, is really understanding that person and their life journey to try and put the symptoms into context.
Someone's asked in relation to how the landscape is at the moment in getting support and diagnosis and that. How can people generally help to move forward if they're getting privately diagnosed? And I think there are clinics out there that are dodged. There's always going to be practitioners that are dodged. But generally, what we see a lot of in the community is people that work on the NHS and private doing diagnosis. And actually, you could get seen by the same person in the NHS or in a private practice, but the private practice diagnosis wouldn't hold weight, even though it could be the same practitioner. Like, do you think there's got to be movement with that to consider the private diagnosis more to enable treatment and support?
So I think this is completely bizarre. Okay, if you're, and we've never seen it in medicine, I think this is a type of stigma against mental health and ADHD in particular. This is what's going on here, everyone. As long as I've been in practice, if you've got a doctor who's registered with the GMC, has a license to practice, and is giving an opinion, whether it's NHS or private, there's never been a discussion as to how valid is it, ever, in any other discipline. So you've got GPs that get letters from private doctors all the time for rheumatoid arthritis, for diabetes, for surgeons, for surgery that happens this is nothing new, and they're often asking GPs to do things.
And I think one example people use is the shared care agreements that often come with things like insulin.
Yeah.
So the GPs aren't trained within treatment for diabetes and stuff, but the shared care agreements is kind of a given. But when it comes to the medication to support and help individuals who have ADHD, there's such a pushback and a resistance. And I think some of it is around knowledge. Like some GPs in England don't understand the right to choose and the shared care agreements and all things like that. Their knowledge isn't there. But
so
others,
it is ignorance, and it is a prejudice, because with the shared care agreement for ADHD, and I've actually got many of these with most GPs are absolutely fine, I have to say, but some are really difficult, and it doesn't have to be that way. The only thing that the shared care agreement requires a GP really to do is to check blood pressure and pulse and do some weight and maybe some bloods once a year. It's nothing out of the usual. Okay, it's probably less than what other shared care agreements require them. And they're kicking up a fuss. And they're kicking up a fuss because, again, they're prejudices against ADHD and also about stimulant medication. That, they're scared. They're not thinking about what's best for my patient. They're scared themselves. This is a stimulant drug. It's amphetamine based. This can't be good. And whether it's a conscious or subconscious, it's out of fear and it's out of prejudice. And that's the thing that has to change in the culture. Without that change, then, I think we're still going to be in the same situation. There is no difference, in my view, between a private opinion and a NHS opinion, because the doctor's the same. Most of the doctors in private practice either have done a career in NHS or still work in the NHS. And we've never had this idea before that one doctor's opinion is more valid than another's. You kind of accept that in other fields, you accept that doctors will have different opinions. But in psychiatry, for ADHD, oh no, what is that grounded in? And the only way I can understand is that it's to do with stigma and prejudice against people with ADHD.
And I think with that, and obviously every practitioner is different. I think a lot of people hearing somebody with the experience of yourself almost validating how we feel, because so many people feel that way, that because it's lack of understanding, lack of desire to understand, and also a prejudice around the mental health and the neurodivergent conditions, that's felt a lot by us as patients and citizens. And although obviously you're one fish in a huge pond, but actually I know a lot of people would be grateful to hear that they're not just imagining it, that unfortunately in places it is happening and that prejudice is real.
But I would like to end on a positive point, because I had a discussion with a GP just a couple of days ago, a GP in London, and she was talking about how there is a movement now in primary care for GPs to get training specifically on ADHD. So not only can they recognise it better, they can actually do assessments themselves. And there is a movement, there is a drive, there is a recognition by the Royal College. So it's coming from high up, the Royal College.
That's encouraging.
And I think that's exciting, that GPs are seeing this problem is too big for us to keep ignoring. And so I do expect there to be some change. I don't know how long it's going to happen, but I'm seeing some positive responses, because that took me off guard as well. I didn't realise things were so dynamic in primary care. I'm not a GP, so I'm not there line with them, but there's certainly a culture shift that is about to take place, and it might not happen as quick as what people like, but I think it's coming, and that's a real positive thing to look forward to and end on.
Yes, absolutely. Well, I'm aware of the time. Firstly, thank you very much for joining. I think the knowledge you've shared and the insight will help many, and also I think it's reassuring that there are good people out there who are actively trying to support people, the neurodivergent community. So thank you for that.
It's been a real pleasure. I'd love to come on any time. Just let me know.
Yeah, that's great. I'd love to do that down the line. If there's any updates and we can schedule things in, that would be fantastic.
Thank you so much, and thank you everyone for joining in and participating.
Fabulous. You take care. Anyone that's watching that isn't following, go and jump over, drop a follow, because there is some great content over there. And yeah, it's nice to feel like we've got practitioners on board with us for the better picture. So thank you very much.
Thank you. Thank you. Take care.
Take care.